Welcome you, ma'am.
Ma'am has completed her BAMS from Balahanuman Ayurveda Mahavidyalaya, securing second rank in Gujarat University, menstrual taboos and Rajaswala Paricharya from Parul University. Presently working as Professor and HOD, Department of Prasooti, Streeroga, G.J.patel, Institute of Ayurvedic Studies and Research, CVM University, New Vallabh Vidyanagar, Gujarat. Ma'am has attended more than 80 national and international seminars, 17 paper presentation in national and international seminars. Ma'am has given keynote address on the topics like designer babies and Garbha Samskara in international seminar conducted at Bali 2019. Research on menstrual practices, women's day, etc. Next, Ma'am has published more than 54 research papers in peer-reviewed national and international journals. Published 3 books, and latest books is on Garbha Sanskara technique as investigated Ayurveda. Ma'am has given guest lectures, more than 130 guest lectures in national and international seminars. Ma'am had been research person in CME sponsored by Ministry of Ayush, coordinated by RAV ITRA Jamnagar. Faculty development programs, webinars, workshop on women health, women empowerment, infertility, prenatal and postnatal care in Ayurveda, menstrual hygiene, Rajaswala Paricharya, Garbha Samskara, menopause, cervical erosion, PCOS, Uttarabasti, Stanika Chikitsa, etc. and its management. And designer babies and Garbha Samskara, 4 modules on GAP Academy and 4 video lectures recorded at All India Institute of Ayurveda, New Delhi for online learning management system and development of e-module in Prasooti, Tantra and Streeroga by Ministry of Ayurveda.
Invite Dr. Jasmine ma'am to share her insights.
Thank you. Very good morning to everybody. Respected dignitaries present on the dais and senior faculty members. Theory part more. But practically what we are doing in my limited experience of 17, 18 years, what we have been doing, what innovations we do apart from the classical text, whatever being mentioned, that is, so we know that for gynecology we have 3 different aspects for Ayurveda gynecology practice. And we all know that what are the classical references which are mentioned for Stanika Chikitsa. And these are the local procedures which we implement more in our day-to-day practice, starting from Uttarbasti, Dhavan, Prakshalan, Pichu, Potli, Agni Karma, Dhupana, Vartik, Shar Karma, Yoni Lepan and Yoni Puran. Amongst this, I will try to explain maximum as much as possible what we are doing. So where it is indicated, if we see in the practical indication, classical indication, many things are mentioned. But practically where we implement this Stanika Chikitsa, starting from very general local vaginitis to cervicitis, erosion, dryness even, incontinence, genital prolapse, dyspareunia, vaginal rejuvenation even, where in the postmenopausal conditions and menstrual abnormalities, infertility, fibroids and PID also. So in all these cases, the Stanika Chikitsa is being utilized along with the other Panchkarma and along with other shaman therapies. So why it is so important, the local treatment, why it is so important? Because we have to understand the vaginal defense mechanism also. Not only the defense helps in protecting the infections, but also it leads the vaginal microbiota. Nowadays it is thought that the systemic illnesses, even the PID, endometritis, infertility, all this is happening because of dysbiosis in the vaginal microbiota. So it is very important to maintain the vaginal defense mechanism by maintaining the vaginal microbiota, and this our local therapies help to maintain, because we know that from modern point of view, they use the antibiotics and antifungal that destroys the natural microbiome also. So our therapies, when we utilize, they will maintain the vaginal microbiome. So that is very important for maintaining this defense system. So yes, these are the bacterial vaginosis associated with the vaginal microbiome, how it is going to lead with different conditions. In the end, you can see that it leads to preterm birth also, spontaneous preterm birth and pelvic inflammatory disease and many more. So it is why this is important. Yes, these are certain reproductive outcome evidences that how this vaginal dysbiosis may cause. These are the research papers which are already published, and it shows that in infertility and even in assisted reproduction it fails. Only because of minor infection which is being prevalent since long, the IVF implantation may fail. So even recurrent miscarriages, preterm birth, and other conditions like preeclampsia. So all are related with the vaginosis. We feel that the infection is a minor thing, it's a local thing, but it may affect all these conditions. And how this may happen, we know that we can understand the changes in the vaginal pH. And there are so many factors which can change the vaginal pH system, right from the hormonal variation throughout the cycle, oral contraceptives, long-term use, antibiotics. If any patient comes to you with any kind of changes in the discharge. Achha, okay, fine. Thank you. Thank you. Am I audible now properly? Okay, fine. So, oral contraceptives like long-term use of contraceptives or also may change the defense system and pH. Antibiotic therapy, unhygienic conditions, stress even. If the patient is undergoing stress for a longer time, maybe social, economical, financial or treatment-based stress also. That also may lead to change. Even frequent coitus, female hygiene products which are nowadays V-wash. Every patient comes to us and say they are using the V-wash. But V-wash is also not natural, it is synthetic. It is made from certain chemicals, and long-term use will always try to destroy the natural lactobacillus, dodel and bacilli which are present. Then female medicines treatments, not ours, like Panchvalkala and Trifla, they are not going to harm, but other treatment medications may harm. And even sexual transmitted diseases, and very importantly is faulty dietary habits. So we know that all the paricharyas which are mentioned in our classical text, right from the Rajaswala, Garbhini, Prasuta and Sutika also, they are all to maintain her defense system and the balance. So these are again the risk factor. Excessive use of soap. Some patients they feel that they are very over hygienic and they use the soap maximum. So that also causes imbalance in the vaginal pH, because each and every soap are alkaline in nature. So they will change the vaginal pH, which should be acidic. We all know that. Use of deodorants and all, these are the risk factors. And how to check the vaginal pH, this is very common. We can use a strip, pH strip, and we can check. Is a routine procedure, is a routine PS examination, we can check the pH. Why again it is important? Because the choice of your medicine which you are going to give locally, this will help you a lot. If the pH is more towards acidic, you select Panchvalkal. If it is more towards basic, you select Trifla. So based on the pH, you can select the medication. Yes, this modern science is going leaps and bounds towards the innovation of the local therapies, especially in the form of micro and nanoparticles. Recently they have made a patent of curcumin also as a nanoparticle. So we are very far behind. They have made Haridra. They have utilized it in the form of nanoparticle, and they are using it in the PCOD also. So we are still very far behind to make our medicines in the form of nanoparticles, suppositories, pessaries, gels, film patches, vaginal rings and other therapies. Why it is important? Why it is so important? Because it has the immediate effect. It is novel approach of Ayurveda to treat various medical and surgical illnesses. Why surgical illnesses? Because we treat the patients with cystocele, vaginal prolapse, uterine prolapse, first degree, second degree, even those who are told that go for a surgery, go for colporrhaphy, perineorrhaphy and Manchester Fothergill operations. Them also we treat with the local therapies like mushak tel or udumbaradi tel, potli, what we keep in the vagina, and the progress of the prolapses decrease. So that is why in surgical conditions also it is having systemic effect, as we know in the Uttar Basti and all. Parasurgical because it doesn't involve any sharp instrumentations and with least complication. If you do it with proper standard operating protocols, is that transplantation, vaginal microbiota transplantation. So they take the microbiota from a healthy person, healthy individual, and they process it and transplant it into the individual who is important. So this is the new emerging therapy. So what are the advantages? We know ease of access, minimal side effects, high vascularity, more permeation area because it has a large surface area. So as I said, it is having hydrophobic and hydrophilic both areas. So we need not worry whether it is quath or pichu or it is lep in the churna form, whatever drug you put in the vagina for therapy, it will get absorbed. So which will be the ideal vaginal drug? If you want to innovate some new vaginal therapy, which will be the ideal? Safe when administered, and it should be non-irritating, is effective against many vaginal pathogens. It may it be trichomonas, candida, bacterial vaginosis. So it should work against more pathogens, effective within a wide range of pH. It should not be like it works only in the more And Pradhan Karma, we know that lies in the lithotomy, and we have to wash and everything. And this is how the douching is being done. And in any kind of infections, vaginal infection and even erosion, if the patient doesn't want to go for another therapies like Agni Karma or Kshar Karma, you can treat with the Dhawan and Pichu itself. And yes, this is innovation that nowadays patients are working. They do not want to come every day to you and ask for that go. So they ask that give us the decoction, we will prepare and we will do the douching. So these are the instruments which are available for self-douching. But one should be very careful while administering that there should not be any air inserted inside. So air should not be there, only what? The disadvantage is that you can see the size of the bulb. The size is very less, it may be around 200 ml or so, 250 ml. But if we take douche, we take about 1 liter of the quath or anything. So she may have to do it again and again. But it is that it will save time for her. Upper, niche, upper. Okay. So again, these are the innovations in the instrumentation. If nothing is there, then the syringe also along with the hollow tube can be used. Even some are using hot water bag along with the nozzle, because the lukewarm temperature will be maintained. And if you see in the middle, there is a valve also, so there is no regurgitation of the fluid. So such kind of douching instruments are also available where there is a valve, so there will be no regurgitation, there will be no passage of air also. So we can devise such things. Yes, you can see that this IV, even pint is also being used for doing this. So these are, and even you can see the nozzle also. Our nozzle only front side entry is there. Here you can see the nozzle is having fountain like fluid. So it will go wash entire vagina. So these are the classical indication. I will just want to highlight that honey is used in many places in classical indication, that honey is used for dhavana. And why it is used? Because the honey is having acidic pH. Okay, if you see that it is having acidic pH, and even if it is diluted, it is said that when it is diluted, hydrogen peroxide is created. If you add honey in any liquid, it will create hydrogen peroxide. And we know lactobacillus also creates, Dodalen bacilli also creates hydrogen peroxide, which makes the vaginal pH acidic, which is 3.2 to 4.8. And the pH of honey is also 3.2 to 4.5. So that is why in classical text also at many places you will find that they have used honey mixed with many other liquids. So that can be utilized. Yes, these are the practical indications where we use very commonly trichomonas, which is a protozoal infection. Then candidiasis, which is a fungal infection, bacterial vaginosis, polyp and everything, chronic infections, PID even, endometriosis even we use dhavan and pichu, because we cannot do intrauterine procedures much. And as purva karma of Uttar Basti, Agni Karma, Kshar Karma, Yoni Dhupan and Yoni Pichu. As a purva karma at all these conditions we use dhavan. I hope you can identify the infections. The first one is strawberry appearance, you can see that is trichomonas. Beside that, it is a fungal infection where curdy discharge is seen. Below again a frothy discharge, but it is a bacterial vaginosis because it is white in color, not greenish in color. And greenish tinge with froth is trichomonas. Again, it is a classical sign of, and you can see that a patient with erosion. So in all these conditions, as I said, what kind of therapy you are using, what kind of material you are using. So if the patient is of trichomonas vaginosis, then the pH will be more towards alkaline. So alkaline pH hai, then go for Trifla. Okay, Trifla contains Amalki. So it will try to balance, because Panchvalkal, there was a monograph published by CCRS long back under respected Rama Vaidya madam, and there the pH of Panchvalkal was basic. So where the pH is more, so this is the Varti. You can use a candle or even a spirit lamp or whatever you have. Just you have to make it red hot.
પકડો બહુ નથી, સોજો બહુ છે તમને ચાંદા કરતા. ચાંદા કરતા સોજો બહુ છે, થોડું ચીપલી જેવું લાગશે. હા,
so to make it red hot, because then only it will burn properly. To make it red hot, and then just you have to apply on the areas of the erosion till Samyak Dagda Lakshan is achieved. Samyak Dagda for Masa Dagda is Kapot Varna, okay, and shrinkage of the tissue and stoppage of the bleeding. So till the bleeding stops, if any is there, and Kapot Varna, that should be established. From red color, it should be going to Kapot Varna. It is taken by our UG students, but it will be seen. One more video is there. You can start with that. Forward it. Yes, yes. You can see over here. Okay. So the area of erosion, we have to burn it with this Varti, and no zero recurrence, no complication, and no recurrence. Okay. Even I have taken follow-up for about 16 years also of the patient. There is no recurrence of erosion. See, this is what we want to achieve. And after this, you have to apply the Jatyadi Tel and Haridra Pichu. Yes, sir. Next video. In this, the patient is not bleeding, but this was a patient who was bleeding profusely throughout the procedure. So you can see the erosion. It took about 25 minutes in this patient to complete the procedure because she was bleeding continuously. So till the bleeding stops, you have to perform. Yes. It was a very chronic erosion and she has taken multiple kinds of therapies, but she wanted to conceive. The modern people said that go for hysterectomy, but she yet had to conceive. She was a patient of secondary infertility also. Just forward it, sir. Okay, you can see, appreciate that how the bleeding is, slowly, how the bleeding stops. All the areas you should cover at a time in one single sitting. If required, second sitting can be done after first cycle. Just forward, sir. You should be very careful. Cervix is insensitive to touch. Okay, no anesthesia needs to be given. Cervix is insensitive because it has no nerve endings. But vagina is not insensitive to touch. So if by chance you just touch on the vagina, she will feel burns. So either you can use couscous, which will be more helpful, or if you want to use Sims, your hand should be very steady and counsel the patient that she doesn't like jerk like this. If it
Thank you so much, ma'am.